Urinalysis. This test is performed as part of a general health examination. And when you have symptoms of urinary tract infection, such as abdominal pain, back pain, frequent urination than usual, painful urination, as part of pregnancy checkup, as part of hospital admission or pre-surgical workup. This test is used to screen for, help diagnose, and/or monitor several diseases and conditions, such as kidney disorders or urinary tract infections. The sample required is 5 to 6 milliliters of urine. Early morning sample is preferred. A urinalysis is a group of physical, chemical, and microscopic tests. The tests detect and measure several substances in the urine, such as byproducts of normal and abnormal metabolism, cells, cellular fragments, and bacteria. Urine is produced by the kidneys, two fist-sized organs located on either side of the spine at the bottom of the rib cage. The kidneys filter waste out of the blood, help regulate the amount of water in the body, and conserve proteins, electrolytes, and other compounds that the body can reuse. Anything that is not needed is eliminated in the urine, traveling from the kidneys through ureters to the bladder, and then through the urethra and out of the body. Urine is generally yellow and relatively clear, but each time a person urinates, the color, quantity, concentration, and content of the urine will be slightly different because of varying constituents. Many disorders may be detected in their early stages by identifying substances that are not normally present in the urine, and by measuring abnormal levels of certain substances such as glucose, protein, bilirubin, bacteria, red blood cells, and white blood cells. Abnormal test findings are an indication or a warning sign that likely there is a problem that needs to be addressed. However, the results do not tell the healthcare practitioner exactly what the cause of the finding is, or whether it is a temporary or chronic condition. A normal urinalysis also does not guarantee that there is no illness. Al-Borg Medical Laboratories. Watch more at our YouTube channel.